Yeah, dude, that functional training book.
It's all functional.
It's functional. Yeah.
Steve, Harold.
Anterior forms, dude.
Yep, educate yourself.
Yep, nice. There you go. Good correction. Nice. Good.
Very good.
What's up, guys? Austin Yoakum back with another Anatomy Tuesday. You saw our functional training, you saw our dance moves, practicing those because it's cuffing season coming up, baby. Rotator cuff week is this week. Mark's gonna dive in and explain everything about it.
All right, so we have 4 muscles of the rotator cuff. To make it easy, all of them are going to originate on the scapula and insert on the humerus. So we have the supraspinatus, infraspinatus, and the teres minor. These are all going to originate on the posterior side of the scapula, and they're all going to insert on the greater tubercle of the humerus. And then underneath the scap, on the anterior side, we have the subscapularis, and that's going to insert on the lesser tubercle of the humerus. Now, supraspinatus, infraspinatus, and teres minor are all going to work to laterally rotate the shoulder, or externally rotate the shoulder. And then we have the subscap, which is going to internally rotate the shoulder, medially rotate it. And now all these muscles are going to be really important for dynamic stability of the shoulder joint. And what that means, so let's say this is the head of our humerus, they're all going to attach over the head of it, right? And they're going to hold this in place in the scapula. So we're going through different movements, different ranges of motion. Our humerus is strong and stable in that shoulder joint.
Sweet. So now that we know where these muscles are, why should we really care about where they are?
So when we talk about the shoulder, we're looking at probably the most complex joint in the body. It's very mobile, and its primary function is basically to perform actions with our hand, right? So get our hand in space to perform different tasks throughout our day. So obviously very important. We just talk about being a human, going about our daily business, and performing those kinds of actions. We want to have a strong, stable shoulder that's not going to hurt when we do things. So when we talk about kind of common problems for the shoulder, we're looking at kind of three main injuries. We're looking at acute or like blunt trauma injuries. We're looking at degenerative problems where we're kind of in a biomechanically disadvantageous position all the time, and we're looking at overuse injuries. So a lot of repetitive tensile stress on those joints. That's looking at baseball pitchers, swimmers, volleyball, tennis, any overhead athlete. That's kind of what we're looking at. So again, shoulder, very mobile joint. We want to make sure that we're able to stabilize that joint.
Yeah, and then as an athlete, let's break it down into, like Mark said, this shoulder is used to move your hand. Now let's think about sports. What sport don't we use our hands? Swimming, using our hands. Even soccer, where everything's with your feet, you're running, you're using your hands. So our primary goal is to keep this joint healthy. The best way to get good at your sport is to practice your sport. The best way to be able to practice your sport is to stay on the court, stay on the field, and practice without getting injured. So if we're able to keep this joint healthy, we're able to practice more and get better at our sports. Good, so we talk a lot about internal and external rotation and the importance of it, and we realized we never really covered what internal and external rotation is. So Mark's going to dive into what it is and why it's so important.
Yeah, so I think a good way to mention it is maybe look at posture when we talk about shoulder internal and external rotation. So we spend a lot of time in that internally rotated position. Our shoulders are rolled forward. From this fulcrum here, we're kind of rolled in. And a lot of our lifts tend to be more internally rotated. And even a lot of our rehab exercises, we're really focusing on that internal rotation. So we're very strong internally. We're not as strong externally. So again, internal coming in like this, bring the shoulder in, or bring the shoulder down like that. Internal, external, rotating it outward, rotating it outward.
Good, so now we covered what internal and external rotation is. We're going to look at a couple of examples of an internal and external rotation exercise.
Okay, so like we mentioned, internally we're very strong. Externally we're not quite as strong. We have a muscular imbalance between the two. A lot of our lifts are already internal, and we need to focus on the external. So just from a rehab standpoint, I see this all the time. You walk into the training room, we got guys and girls doing their internal rotators all the time, continuing to work that muscle. I really want to focus on the external aspect of it. So one thing you can do, grab a towel, grab a t-shirt, put it underneath your arm here, and just try to isolate this rotator cuff muscle instead of using any other muscles. And we're just going to externally rotate, increasing the resistance as much as possible. The stronger we get in this joint, the less likely we are to get injured. So more cues we can do before our lifts. Austin's going to show us.
Yeah, so going off of this, We mentioned in the video that a lot of our lifts were very internally rotated, so what we want to cue is external rotation, and we use cues like breaking the bar, twisting our hands out. If we had a piece of paper in our hand, we'd squinch it up. But one thing that we can do as an exercise to really cue this is you grab a band, place it 2 things apart here. We're sticking our hand here, we're locking our shoulder blade back, and then we're just going to cue that external rotation. So we can do a couple sets of this, 5 reps, right before we bench, and cueing that external rotation. So we're twisting out, we're breaking the bar just like this. This is one exercise I would suggest right before we bench, right before we military press, anything that we're twisting out with that external rotation that'll really help the feel of that breaking the bar.
Okay, so like we talked about, the shoulder is a very mobile joint, the SCAP is a very stable joint. How do we reinforce these things?
Yeah, so this is where it really goes back to Mike Boyle's joint by joint theory, and then Mike Boyle's also stream theory of you need to work one muscle, and one muscle affects the other muscle. So if our SCAP isn't stable like it's supposed to be, that's where we're going to have issues with mobility at that glenohumeral joint. And that's where we're going to get a lot of the injuries in our shoulders. So we need to focus on exercises that are going to keep that SCAP stable. Also, on the other hand, so it works both ways, the streams up and downstream. If our glenohumeral joint isn't mobile, that's where we're going to get a lot of issues with our SCAP stability. And that's where we're going to need to focus on glenohumeral mobility. So Mark's going to explain the SCAP stability, and I'll explain the glenohumeral mobility.
Yeah, so again, this is going to rehash a lot what we talked about last week, where our scapula is pinned on our thoracic cage. And the muscles that are going to do that, like we covered last week, the lats, the serratus anterior, the rhomboids. A lot of those similar exercises. We want to work those big muscle groups, and this week we want to add in some working the smaller muscles in that area. So we're looking at a lot of Ys and Ts, a lot of wall, scap slides.
And there's one if you lay on the ground we can show you. And this is one for a lot of baseball players that we can do, is if Mark sticks his hand straight up, this is where if Mark's working through his breathing patterns, he can work the stability, but we just give him a couple bumps here. And this is where we can work on, this is another cool thing from Eric Cressy we stole from him, that we can just work that stability on the glenohumeral joint, moving through this. Good, so we covered SCAP stability. Now we're going to go over the glenohumeral mobility. Big thing here, and we talked about it last week a little bit, is opening up those internal rotators, opening up that chest and lat, the things that are really pulling us forward. Those are the things that are going to keep that glenohumeral joint immobile, and again, it's going to mess up that SCAP stability, and even go as far to messing up those elbows and that upper back.
Yeah, so these, like we've covered, all really good things to prevent injury. But if you're somebody who's already in pain, if you're already injured, what are some things we can do to kind of help get out of that pain, help us start getting on that right track to rehab and strengthening it? So a couple things, like we've talked about, it's pretty much all going to be the same. We have a problem with our internal rotators, so what we want to do is loosen those up, open them up, make sure we're kind of in that right positioning. Another thing is we want to mobilize the T-spine. If we're really tight back here, it's just going to leak into this area and kind of throw everything off. We want to strengthen the upper back muscles. We want to strengthen everything that has to do with scapular stability. That way we have that mobility and we have a strong base to build from. And the other thing is we want to maintain that muscular balance. So like we've hashed on, our internal rotators are a lot stronger than our external rotators. So just keeping that muscular balance, keeping that symmetry is really important.
Yeah, and diving into, we're already in pain. Again, when you're in this like shoulder impingement, a lot of times you don't feel the pain in your shoulder. It can be up and downstream. So either in that upper back neck area or that elbow. A lot of people suffer from a lot of elbow issues, and their solution is to rub out the elbows, to roll out the elbows, which helps temporary, but it never really solves the problem, because the problem again is up the stream. That shoulder impingement is causing something to happen in that elbow. So I urge you, if you're looking at that elbow, you have a lot of pain in that elbow, you're a tennis player, golf player, you have a lot of pain in that elbow, attack that shoulder, open up that shoulder, do the things we're telling you, and then come back and tell me how that elbow feels.
Hey, my name's Steve. So, you just injured your rotator cuff. Now what? What are you gonna do? You're just gonna sit home, sulk? You're gonna go try and roll out your elbow? What you're gonna do is contact Mark, Dr. Mark. He's gonna set you up with me, Steve. I work at Way Laboratories. We specialize in naturopathic treatment remedies. So specifically for the shoulder, what we would use is called the Whitey patch, which is a topical patch which herbs are transdermally absorbed through the skin to help accelerate blood flow, increase lymphatic circulation. And in this, what we're ultimately going to do is create the optimal healing environment to change your body from that inflammatory state. So just give me a call, 612-808-9239. We'll get you right on board, get you an appointment with Dr. Mark, get you on the track to healing.